Hello, everyone, and welcome to another edition of COVID-19 Power Lunch, our twice-weekly video series where we discuss new developments and new legislation related to the coronavirus pandemic. As a reminder, I'm Erin Spivak, partner with James Moore & Company, and I'm the moderator for the series. Over the past month, we've received a lot of questions from healthcare providers about the HHS stimulus payments that were made under the CARES Act. Joining us today for this discussion are Hutto and Stacy Joyner, partners with James Moore & Company and members of our healthcare segment team. Stacy, I know a lot of healthcare providers were surprised earlier in April when they received direct deposits or checks without warning with a notation that simply said HHS stimulus. Can you give us a summary of what these payments were made under as part of the provider relief funding under the CARES Act?
Sure, Erin, I'd be happy to. Under the CARES Act that was passed on March 27th was included $100 billion of provider relief funding, and 50 of this was designated for general distribution to those facilities and providers that were Medicare providers and impacted by COVID-19. The intention of those payments was to support healthcare-related expenses or lost revenue attributable to this coronavirus pandemic. The initial $30 billion of this $50 billion allocation was what went out on or around April 10th, and what surprised a lot of people when it showed up in their bank account. The remaining $20 billion is being distributed weekly beginning on April 24th and ongoing.
So how did the HHS determine how much should be sent to each provider out of that initial $30 billion?
Great question. HHS used their data from their system from 2019 related to each provider's share of fee-for-service Medicare reimbursements in order to compute the initial payment. The payment that those providers received was roughly equal to about 6.2% of their total 2019 Medicare fee-for-service reimbursements.
That makes sense because we saw a pretty varying amount that was deposited or sent to those providers. So it probably depended on how many Medicare patients you had is how much you got in those fees.
Exactly.
Now, yeah, so can providers get access to that additional funds that you referred to under this program?
Yes, they sure can. The additional $20 billion was available beginning on April 24th, and as I said, it's ongoing until it's depleted. If there is a provider that believes they should have gotten more or they didn't get any at all under the original allocation, they can go to the hhs.gov website and enter the general distribution portal where they will submit their cost report data and revenue data so that they can be eligible for an additional payout. And those payments are expected to be paid out weekly on a rolling basis, again, until they're depleted.
Yeah, and I think I read that they weren't doing them on a first come, first served basis. They were actually looking at them probably more than once a week, but they were actually just doing them once a week based off of their analysis of the data. So there isn't like a big rush that the first come, first served will eat up that 20 billion, right?
Correct.
Okay, so Jay, so what are the differences between the two primary types of these $50 billion in the CARES provider fund payment?
Well, the $30 billion was based on the Medicare fee-for-service reimbursements for 2019. So that was automatically sent to providers, and it was going to, help them fund, COVID-related expenses. But then there was some concern about whether that the Medicare fee-for-service base was really appropriate for funding things like children's hospitals or patient providers that don't necessarily get most of their funding through Medicare payments. So they set $20 billion aside for those types of providers. They're using the CMS cost reports as kind of a basis for determining the amounts to be paid to those providers. But there is that general distribution portal, as Stacy mentioned, where you can go in and you can enter your revenue data and kind of check on the status of that payment as well.
Yeah, because obviously what we talked about with the first one, they kind of just did it based off a calculation. The second one, you actually have to put a lot more information and submit additional data to get approved, correct?
Correct.
Okay. So I know one of the questions that was on there was talking about like lost revenues for March and April, and they even gave kind of a guideline on how to estimate what your lost revenue is. So I know one of the things that we wanted to point out to people was that when you're looking at your revenue, you should be looking at your billings, not your collections for those months, right?
Right. I mean, it's going to be your, that's effectively for most of these providers is going to be cash basis is how they're reporting their revenue. And so that'll be kind of the foundation for when the reporting begins.
Gotcha. So Stacy, are these payments considered loans? Are they required to be repaid?
The HHS has indicated that they are not loans and that they will not need to be repaid, but that's pursuant to them certifying that they meet the requirements of the program and that they use the funds in the manner prescribed in order to keep it. So in other words, if they were to use it, for expenses that are ineligible or they're not factually certified, then they would have to potentially return the money.
That's important. So does that mean the providers need to sign anything or verify their payment amount?
Yes, they do need to go online and sign the Attestation Agreement, which is the first portal you'll see if you go to the HHS website. That's supposed to be done within 30 days of receipt of the money. If you fail to sign the attestation or return the funds, they are going to, by default, consider you having signed. So if you do nothing, you will essentially attest by silence. They also need to provide that revenue information into the general distribution portal on the HHS website, and that's where they're asking for your estimate of lost revenue in March and April.
Gotcha. So Jay, what's the process of actually signing the attestation?
So there is a portal, it's a payment portal that they've set up on the website. To get to that website, I think we're going to put that on the screen for this presentation, but you can also go to jmco.com. We have a COVID-19 page that has a lot of our articles, resources, and this will the link for this will be on that page as well. And but when you go to the portal, you're going to confirm receipt of the funds. You're going to identify all of the taxpayer identification numbers associated with the same billing entity, and then you're going to agree to the terms and conditions for the payment. Or you can reject the funds if you don't feel like you meet the terms or can meet the terms and conditions. You have 30 days to do that, but as Stacy mentioned, if you don't do that within the 30 days, they will automatically deem that you have accepted the terms and conditions and accepted the funds.
Yeah. So Jay, that kind of leads into the next question. What are the actual terms and conditions?
Okay, so that's really the key because some, I think, providers thought that the money just showed up in their account, that's their money, they can spend it however they want. When we really started looking into those terms and conditions, that was not the case. And it specifically says that non-compliance with these terms and conditions is a condition for recoupment of the funds. So we don't know the mechanism whereby they would take those funds back, but they've already clearly said that that can occur. Certainly you must have billed Medicare in 2019. Obviously that's how they base at least the $30 billion payments on that. You must have current privileges. So there was some concern as to, if I practiced a year ago and I'm not practicing today, or if I had a clinic open a year ago and I didn't practice today, I mean, obviously that is not having current privileges. So that is one of the terms and conditions. You must provided diagnosis, testing, or care for individuals with possible or actual cases of COVID-19. Now, the good news is that they've established kind of a broad view that almost any patient could be a possible case of COVID-19. So that was one of the early concerns as to how specific to COVID-19 that this was this requirement. And they have at least alluded that it would be a relatively broad term or broad view of those terms. One of the other key terms, though, is that the payment will only be used to prevent, prepare for, and respond to coronavirus, and only reimburse for healthcare-related expenses or lost revenues that are attributable to coronavirus. So that's really what we consider the key term, because it's going to be real important to kind of develop those systems for trying to track and and be able to ultimately report on those costs, at least for that lost revenue. Another term or condition is that the provider not use the payment to reimburse for expenses or lost reimbursed from other sources. So there's a lot of COVID payments rolling around out there, and we have to evaluate that. And then you have to submit reports to ensure compliance. Now, these reports are quarterly. The first report would be in July, and it would only be for those people who received $150,000 or more in total funds. So I believe a lot of our clients were probably excited that they were under the 150. We don't know, maybe there's audits that could come still on those, but at least as far as this reporting mechanism, they won't have to do these quarterly reports to kind of document these costs and their compliance with the terms and conditions.
Yeah, as we've seen, like, this is a pretty fluid situation that we wouldn't be surprised if following the second quarter, that 150,000 either meter gets moved down or they require less reporting, but still some sort of attestation of how you use the funds. And particularly, one thing I want to ask you about is you mentioned like other COVID-19 sources or other sources of funding. One of the big things that I know a lot of people got was the PPP loan, which could be used for payroll during an 8-week period following when they got the loan. And there's some questions that if you use part of this stimulus payment to reimburse payroll, how do those two interact, or what's our best guess at how they interact?
Yeah, I mean, our best guess without any real clear guidance at this point is that based on that term and condition would be that if you use that payroll for purposes of forgiveness on the PPP loan or Paycheck Protection Program loan, then you would not be able to effectively double dip and take that as a payment on the reporting for this particular payment program. So again, just reading that as it states, we would believe that you could do one or the other, but not both.
Yeah, and that makes sense, and hopefully we'll get some additional guidance of how you break that out and how payroll even plays a part in this. I know there were some specific references to how much compensation could be paid out of the stimulus payment, but again, we're waiting on, and I know we'll get to that in a couple of minutes, of what these expenses or lost revenue, how that can be reported. But first, what you mentioned this reporting, the first one will be in July. What type of reporting is that?
So that is another great question. Probably another key point of this is that they have not released any kind of instructions, the payment portal, or I'm sorry, reporting portal, or anything. But what we do know is this: is that one is that the reporting would be done quarterly. We don't know how many quarters. I mean, maybe it's as long as potentially as many quarters it takes to report that you've used the funds. But we certainly know that the first quarter would be the second quarter of 2020. The first report would then be due within 10 days of the end of the quarter, so that would put it at July 10, 2020. Our feeling would be that they would set up a reporting portal, and you would go into that reporting portal and provide the information that sort of reports the expenses that you've had or potentially lost revenue that you've had that you can attribute to COVID. But again, the HHS has not released any instructions. They have not released that portal. They've not released any forms or even any guidance at this point, other than the terms and conditions that we talked about. It is going to be important, though, that even now, because I mean, we've received, everyone has received their payments, but
right,
that we kind of established some accounting systems so we can kind of monitor those payments and ultimately report those payments. And again, without clear instructions, it's difficult, but some type of tracking of those payments is going to be essential for really maximizing the value of this program.
Yeah, not return it, right? If you
oh,
can. Yeah.
And that's the concern, is that if you can't report how you use the funds, that is, if you're over $150,000, that you could have to return those funds.
Yeah.
Now, the HHS has also said that they're going to use different contractors. They're going to use law enforcement. They're going to use the Treasury, and certainly auditing organizations like James Moore, who do financial and compliance audits. So they're going to use multiple sources for trying to effectively validate the reports that get ultimately filed, showing how the funds were used for COVID-related expenses or lost revenues. So there's a little concern about that. And then they also, though, said they're going to release the names and the of the payment recipients and the amounts, so that we're going to have another situation where there's this kind of we're seeing with the PPP, where whether you're a university that has an endowment or a publicly traded company, you know, some kind of peer pressure on those people who may have gotten these payments could potentially be another issue down the road. Now, we are told that ultimately there's going to be some tools that'll be available. Those are going to be like a lost revenue tool, you know, that help you with kind of identifying lost revenue that you can attribute to COVID, COVID-related expense calculator, you know, some checklists and other guidance that they're going to provide that would hopefully help people, again, be able to identify these costs, identify that lost revenue, get it on a reporting form, and, you know, help them essentially maximize the value of that payment.
Yeah. So speaking of that, like, even though we don't have reporting guidance yet, can you give us some examples of like approved costs that we think we would see related to this?
So I guess I first say there is no guidance. So anything that we speculate is just speculation. But I mean, some things that we kind of think could possibly be, you know, attributable to the program and ultimately reported would be anything that you're doing that's COVID testing, right? So if you're having to test your employees, if you have costs related to just sort of maintaining your operation, managing patients, certainly patient care or administrative assistance or labor associated with supporting calls into the office, remote work arrangement costs. I mean, obviously everyone or a lot of people are working from home, so there's a lot of costs related to kind of that transition. Any conference call fees or you know, subscriptions or hardware software costs associated with, you know, this kind of remote environment. Obviously, IT security is a big issue when we have HIPAA rules, and certainly you want to keep everything confidential. There's certainly in most clinics some level of building security, whether that's keeping vendors out, minimizing visitors with patients, keeping the mailman out, whatever the case may be. But if you have a labor cost associated with someone out front, and you know, they're asking questions about symptoms and things along those lines, we certainly believe that those related costs should be tracked. Certainly have supplies, so we have masks, face shields, anything along those lines you'd want to track. And then, you know, certainly on the lost revenue side, you can certainly hopefully attribute gaps in the schedule to COVID. I mean, obviously we know that there were a lot of, whether it's visits or even procedures that were not occurring because of COVID. So tracking those, whether it was cancellations or just things that could not be scheduled, keeping a cost, you know, keeping track of those costs. But you know, there's cost of getting things out of exam rooms or cleaning them. I think in our office this week we're having commercial cleaners come through and clean the office, and I'm sure with the, you know, in clinics and in patient scenarios, there's even more of that probably going on. You also have virtual health. So one of the kind of potential benefits of all of this is kind of this push now by necessity of going to virtual health. So there's costs associated with that. You've got patient portals, you know, whether you're establishing a portal or enhancing a portal. You've got potential telephone costs. If you have a direct line attributable to COVID, or someone servicing or, you know, kind of monitoring or providing information to patients related to COVID. You've got telehealth. So whether you have a telehealth service, part of your EMR, or you're using FaceTime or, you know, subscriptions like freeconference.com or whatever, those things generally have some level of cost associated with them, and those would be the things that we would say you could relatively safely attribute to, you know, this program.
Yeah, it will really be nice when they actually give us substantive guidance and the reporting form that says these are the costs that are that count, right? I mean, I see turn that form over, but at least this can get people kind of thinking, hey, this would be maybe an expense that could be attributable to a COVID-19 related that I wasn't testing a patient, but here's other expenses that we incurred during these effectively 2 months of quarantine where we didn't have as many patients, we were limited in our procedures, we had additional expenses. How could that have worked? And honestly, continuing going forward, even though a lot of states have started to open back up. And I know in Alachua County, as of yesterday, a lot of surgeries and procedures can now start again. It doesn't mean that there aren't additional costs that'll have to be incurred by providers to maintain that additional level of protection, I guess is the right word to say, for the spread of COVID-19.
Yep.
Okay, so Stacy, what makes up the rest of the $100 billion that was actually allocated in the CARES Act related to this?
So there's a handful of other relief packages that are included in this $100 billion, one of which is an allocation for the treatment of uninsured patients. So if you're a provider and you've provided treatment for an uninsured COVID-19 patient on or after February 4th of this year, you can request claim reimbursement through this program at the Medicare rates. And this is another portal included on that HHS website. And this opened up on April 27th. They did also allocate $10 billion for hospitals in COVID-19 high impact areas, such as New York City. There was another $10 billion for rural health clinics and hospitals, $400 million allocated for Indian health service facilities for the basis of operating expenses. And then they've defined a miscellaneous remainder amount for further separate funding, including skilled nurses facilities, dentists, and providers that solely take Medicaid. So it's yet to be seen exactly what that entails, but that's at least what they've laid out so far of the remaining $50 billion included of the original 100.
Okay. Well, I really appreciate you both giving your time today and kind of talking through what we know and what we still don't know about these payments, and hopefully we provided a little bit of guidance. I do recommend that website that Jay referred to earlier is a pretty good website that they actually, the HHS puts a lot of frequently asked questions and any changes. We have the link on our website for that, but I do encourage people to check that 2 or 3 times a week because they update it all the time. And sometimes the frequently asked questions get updated with just adding 1 or 2 on there. But again, if you have any questions or you aren't sure what if you need to keep the payment, which I know that 30 days is coming up to a pretty close this weekend for that initial drop, please contact us or your CPA to ask if you should attest or basically not attest by not doing anything but getting to keep the funds. And make sure that you understand how these need to be spent over the next few months to a year or however long that period is, so that you don't have to surprisingly give the money back if you weren't expecting it. You can also email us at info@jmco.com. And again, go back to our website, the COVID-19 Resource Center, where we have additional articles and information as well as links to help you with this. So thanks, Jay and Stacy, and I'm sure we'll have another one of these in the next few weeks as we get additional guidance and perhaps some more clarity on that reporting. Until next.